Welcome to the next exercise in the video series. The exercise we're going to focus on are going to be the foam roller exercises. Foam rollers are a very inexpensive way to assist with the mobility of myofascial tissue throughout the body, as well as improve joint mobility and posture for various reasons such as disuse, injury, lack of exercise. Muscles and joints can become stuck or restricted. Using a foam roller is an easy way to isolate and localize treatment to specific muscles, tissues, and joints of the spine and extremities. By doing this, you improve joint play, flexibility, range of motion, release fascial tissue, in some cases break up adhesions, promote blood flow, increase circulation, maximize healing, and reduce pain. All you need is a real simple 3-foot long, 6-inch diameter, half or full foam roller. This is part 1, foam roller. So the first exercise will be chin tucks. Keeping your head on the foam, you're going to press your chin and your neck down into the foam without lifting your head. Make sure that you don't push too hard or too aggressively that you start pulling in the muscles in the front. We're just trying to work the muscles in the back. Keep your palms down flat on the floor as you do this. Hold the exercise for 2 to 3 seconds and then relax. Push down nice and easy for 2 to 3 seconds and relax. You will perform that about 10 times. The next exercise are going to be shoulder blade squeezes. Your shoulder blade should be just about on the foam. All you're going to do is pinch back your shoulders and squeeze the foam between your shoulder blades. Hold for 2 to 3 seconds and relax. Pinch back again and relax, pinch back again, and relax. You're going to go through that 10 times. Then turn your palms up, and you're going to do the same thing. You'll feel different muscles working now below your shoulder blades. Squeeze, hold them for 2 to 3 seconds, relax. Notice that I'm not holding my breath as I do these exercises. So the next exercise we call toy soldiers. One arm at a time. You're going to reach up and over, leading with your thumb. The goal is to get a stretch. If you could touch your thumb to the ground, great, but that's not necessarily the goal. Alternate arms. If you have any shoulder pain, don't push through that pain. Stop when you get the restriction. As you find yourself loosening up, you can also take your hand, and as you get to the top, you can reach up towards the furthest wall above your head. And as you do that, tighten your stomach to hold your back down, and you'll get a very good lat stretch. So the next exercise we call pinches and punches. With your elbows straight and pointing towards the ceiling, you're going to reach up, then pull your shoulder blades back down towards the foam. Reach up, pull your shoulders back down towards the foam. You're going to repeat this 10 times. The next exercise we call ankle grabs. So one at a time with your palms down, you're going to reach towards your heel. Now you'll notice that your head's going to want to rotate and side bend. Try to keep it as still as you can on the foam. The goal is to get a stretch on the side that you're reaching. And you'll do that to the other side. Hold them for 2 to 3 seconds. Reach for 2 to 3 seconds. Reach for 2 to 3 seconds. Then after you've done 10 of those, reach with both hands. Now you won't feel a stretch with this one, but we're going to recruit muscles around our shoulder blade. Again, repeat this one 10 times. The next exercise we call flies. You're going to start with your elbows bent, your shoulders bent at a 90-90 position. Elbows up over your chest bone or your sternum. You're going to let your elbows, your hands and your wrists relax towards the floor as far as you can go. Try not to lead just with the elbow. Try to keep your forearms parallel to the floor. You're going to gently pull back till you feel a stretch across your shoulders and chest. Then you're going to return to the middle. Nice easy motions. Don't force anything. Relax the arms back. 2 to 3 seconds stretch. Return to the middle. And you're going to repeat this 10 times. Don't worry if you don't hit the ground. Just go towards your feet till you feel the stretch. The next exercise we call snow angels. You're going to turn your palms up to the ceiling. We're going to, just like you're doing the arm part of a snow angel, keeping your arms as close, or your hands as close to the floor as you can. Coming all the way up if you don't feel any resistance or pain in your shoulders. Then slide them back down to the starting position. If you feel any pain in your shoulder, you can stop and return to the start. If you feel like you're getting tight in your shoulders and your hands start coming off the floor, that's okay too. Nice, smooth, easy motions. Keeping your head on the foam at all times. Should take you about 3 to 5 seconds to perform the entire motion. Don't rush it, and perform about 10 times. The next exercise will be spinal mobility. You're going to sit off to the side of the roll to dismount. Spin the foam so that it's along your back or perpendicular to your back. Rest your elbows onto the foam. Scoot your bottom down, slide the elbows slowly out till your back is touching it. Bring your bottom up with your feet. Put your hands behind your head. Now you should have your back in a nice level position. Elbows should be relaxed, not up. Head should be level, not back. You're going to start about mid-shoulder blade. And what we're going to be doing is we're going to be doing mini reverse sit-ups and sit-ups. We're going to be mobilizing a few vertebrae in our spine, starting about the mid-thoracic spine. So we're going to extend, then we're going to flex, noticing that I'm just moving at the foam. I'm not moving my head. My head's staying neutral, my hands are supporting my head, and I'm mobilizing that one level in my thoracic spine. If you feel a pop or snap, don't worry about that. Things are just moving in your spine. Roll about 1/8 to 1/4 of an inch to the next level in your thoracic spine. Move your feet back. And again, do a little extension and a little flexion. A little backwards bend, a little bit of a crunch. Do it about 5 to 10 times at each level. Roll 1/8 to 1/4 of an inch to the next vertebral level, spinal level. Extend, flex. You're not going to go any lower than your belly button, and you're not going to come any higher than your mid-shoulder blade. If after the pop you feel any strange sensations, immediately stop. If you have any sharp pain while you're doing this, immediately stop and talk with your physical therapist or your physician before you start again. And dismount, do the same thing. Bring your elbows in, bring the foam roll, get yourself comfortable on the floor. And that is part 1 of our foam roll exercise series. Please stay tuned for part 2, where we'll get into self-massage.